Hello, my name is Catherine Nyland, and I'm going to be talking to you about scabies. Scabies is a highly contagious skin disease caused by an infestation by the itch mite Sarcoptes scabiei. The adult female scabies mites burrow into the upper layer of the skin where they live and deposit their eggs. They are found most often in the webbing between the fingers and toes, in the skin folds on the wrist, elbow, or knee, and on the penis, breast, buttocks, or shoulder blades. In most cases of scabies, there are no more than 10 or 15 live mites, even if there are hundreds of bumps and pimples on the skin, and the condition will get worse and worse until it's treated. The microscopic scabies mite is almost always passed by direct, prolonged skin-to-skin contact with the person who is already infested. An infested person can spread scabies even if he or she has no symptoms. Scabies has been considered by many to be a sexually transmitted disease, although not all cases are transmitted sexually. Sexual contact is the most common form of transmission among sexually active young people. Signs and symptoms of scabies include a skin rash composed of small red bumps and blisters that affect specific areas of the body. Severe itching, especially at night, is the earliest and most common symptom of scabies. The intense itching of scabies can lead to skin sores. The sores sometimes become infested with bacteria on the skin. When a person is infested with scabies for the first time, symptoms usually do not appear for up to 2 months after being infested. When a person is infested with scabies for the second time or more times after that, the symptoms appear much sooner, 1 to 4 days after exposure. An infested person can transmit scabies even if they do not have symptoms, until they are successfully treated and mites and eggs are destroyed. Avoid direct skin-to-skin contact with someone who is infested. Avoid items like bedding or clothing recently used by an infested person. Household members of an infested person or others who have been exposed should be treated as well. Wash clothing and bedding used by an infested person in the previous 24 hours in hot water in the washing machine and heat dry. If items can't be washed, you can starve the mites by placing items you can't wash in a sealed plastic bag and leaving it in an out-of-the-way place, such as a garage, for a couple of weeks. You do this because scabies mites generally do not survive more than 2 to 3 days away from skin. Products used to treat scabies are called scabicides because they kill scabies mites, and some also kill mite eggs. Scabicides used to treat human scabies are only available with a doctor's prescription. You cannot get them over the counter. Scabicides should be applied to all areas of the bodies from the neck down to the feet and toes. In addition, when treating infants and children, scabicide also should be applied to their entire head and neck because scabies can affect their face, scalp, and neck as well as the rest of their body. Treatment should be given to both the infested person and to household members and sexual contacts, particularly those who have had prolonged direct skin-to-skin contact with the infested person. Treatment includes oral or topical scabicidal drugs. Scabies is a common condition found worldwide. It affects people of all races and social classes. Scabies can spread easily under crowded conditions where close body and skin contact is common. Institutions such as nursing homes, extended care facilities, and prisons are often sites of scabies outbreaks. Child care facilities are also a common site of scabies infestations. It has been estimated that about 300 million cases have occurred each year throughout the world. Human scabies has been reported for over 2,500 years. There are approximately 1 million cases in the United States each year. In the U.S., scabies frequently affects the homeless population. There were no statistics listed for scabies locally. Scabies is very easy to misdiagnose because early subtle infection may look like pimples or mosquito bites. Those affected may believe they have another condition such as bedbug bites or other kinds of rashes. The definitive diagnosis is made when evidence of mites is found from a skin scraping test. Some immunocompromised, elderly, or disabled persons are at risk for a severe form of scabies called crusted or Norwegian scabies. Persons with crusted scabies have thick crusts of skin that contains large numbers of scabies mites and eggs. The mites in crusted scabies are not more purulent than in non-crusted scabies, however they are much more numerous. They have up to 2 million per patient. Because they are infested with such large numbers of mites, persons with crusted scabies are very contagious to other persons. Overall, scabies can be treated, so there's no need to panic if you get infected. The best thing to do is immediately go to the doctor so you can prevent it from spreading to anybody else. And please take the preventative and the treatment seriously and tell people about this disease since it's so common, and I feel like a lot of people don't consider it to be in the family with the STDs. Thank you.